So fast coded 21's pre-CPC prep and SDS session. As you guys know, this session is useful for the people who are trying to write the CPC certification exam, as well as the people who are trying to write or learn or join SDS. Usually we will call it as same day surgery coding. So today we are going to learn respiratory and cardiovascular system coding. So just you no need to do anything. Just go to the Google and write fast coder 21 medical coding YouTube channel. You will get all the sessions currently we have within the channel. So today's our first question. So we will give 3 minutes for each and every question, so that I hope that is enough for you. So our first question. Physician performed a thoracentesis of the pleural cavity for aspiration with needle fluoroscopic guidance. First one 3242277012226 modifier, B 32555, C 32557701226 modifier, and 3242126 modifier 77002 TC. TC means it is also a modifier which is technical component. So now it is 9:31. You guys write your answer in the chat box. We will start discussing answer at 9:35. I hope you understand this question. So write your answers in the chat box. Now it is 9:32. We can discuss answer at 9:35. Based on the answers in the chat box, we can discuss the answer. See the question properly and try to find the keywords here. You need to understand what is thoracentesis. Thoracentesis means aspiration of fluids from the thorax. So thoracentesis is the procedure which is usually performed in the outpatient settings, usually for ascites. So write your answer in the chat box. Based on your answer, we can start discussing the answer. So usually use of thoracentesis is to remove the fluid from thorax. So physician has performed thoracentesis of the pleural cavity for aspiration with needle fluoroscopic guidance. So you have 2 more minutes. In CPC exam also, don't skip any question without answer. Try to write each and every answer with your sixth sense. Don't skip any answer, any question. So you need to write whatever you know. So we have 1 more minute. So we have not received any answer so far. But does anyone has the problem with screen? But here it is okay only for me. Do you want answer, Supriya? Sorry, question? Yeah. Physician performed a thoracentesis of the pleural cavity for aspiration with needle fluoroscopic guidance. Our answers are A 3242277012226 modifier, B 32555, C 3255 770 26, D 32421. It is okay, Akhil. It is showing excellent in my software. So even I will try to do that zoom. Can you see now? I have zoomed a bit now. Let me do. Thank you, Akhil. Yeah, try to answer this question. So we have wasted time for this. So I did not get any answer here. So please write any answer. You no need to worry about whether it is right or wrong. So if you write the answer only, I can go ahead. So you need to select any option A, B, C, D, or any one you can write in the chat box. If you don't understand, you can ask me. So I hope everyone is seeing now clearly. So from my side, it is excellent. It is showing my software. So what's going on, guys? No one is provided the answer here. Can you see properly or not? Tell me your problem so that we can go ahead. So what is the problem here? Can you listen me or can you hear me? So write any answer. You don't need to worry about whether it is correct or not. Ramakrishna, Supriya, Sindhu, Anil, Navya, Santosh, Akhil, Devanshi, Sindhu. So write any answer. Can you hear me or not? Plus, first tell me. Guys, are you here with me? Hi, Srinath. Just write your answer in the chat box, Srinath. I think you can see the question here. So if you write answer only, we can continue this session. So otherwise, no need to continue this. I will stop streaming. Why means nearly we have 15 people here. No one is writing the answer. So what is the use with this training? So do we have books or not? Yeah. Thank you, Ovia. I got answer now. So first question, I will give you exception. Hi, Ras. So next question, you need to write the answer. Okay. Okay, Akash, no worries. But it is better if you have the textbook. So now we can see the answer. Second question, sorry, this one. So here physician perform thoracentesis. So thoracentesis means it is like aspiration of fluid from the thorax of the pleural cavity for aspiration with needle fluoroscopic guidance. So here we need to check all the codes. Here we need to filter this question using the fluoroscopic guidance first. So as soon as you see this question, you need to check the guidance. 770 to 77012 will check. What is 77012? But it will take, I think, You guys check in the book so that it is helpful for everyone. What is 77012? No problem, Akhil. Yeah, 77012. No worries. But it is better if you have the CPT book. So if you anyone has the what is 77012, write in the chat box. We will save our time. So otherwise we can check here. So 77012 is what is this? CT guidance. Okay, na? So our is fluoroscopic guidance. Here your keywords are thoracentesis and aspiration with needle. Needle also one keyword, and mainly fluoroscopic guidance is the keyword. So here 77012 is CT guidance. So instantly we can eliminate this answer. So next one is we can eliminate this also. Why means we have fluoroscopic guidance. So if we check 77002, which is fluoroscopic guidance. But if you check the codes 32422, we will check 32422. 32422. What is that? 32422. So what is 32422? Na? So we don't have 32422 in the code book. So we can eliminate. Anyway, we have eliminated this one. So we don't have 32421, 32422 in code book. So we have eliminated C because of it is CT guidance. So we have only B 32555. 32555 is the answer. We can check that. So in CPC exam, like CPC exam, they will give deleted codes also. You need to think in that way also. Why means if you don't know what are the codes deleted in academic year, like in 2023, if you write CPC exam, you keep on searching for that. So before going to the exam, you need to know the CPT updates also. So now we are searching for 32555. I think, yeah. See here, thoracentesis, needle or catheter, aspiration of the pleural space. So 3254 is without imaging guidance. So in our question, we have imaging guidance, which is fluoroscopy. So directly here, we no need to write fluoroscopy code. Directly we can write thoracentesis, needle or catheter, aspiration of the pleural space with imaging guidance. Here we no need to code fluoroscopy code additionally. I hope each and everyone got the answer. So anyway, it is very easy only. Yeah, B is the correct answer. So whoever thought B is the correct answer, as our code description is aspiration with needle with imaging guidance in the 32555. So B is the correct answer. So all are well done. Yeah, thank you, Supriya. So if you have any problems, we can mention in the chat box. So next question. So I got all the people got the answer B. So guys, you don't skip any answer in the CPT exam also or in the chat also. Write whatever you know. If you don't know the answer, write guess. You have the CPT books means you can check each and every code and compare our question with code description. That's enough. Okay, we will go ahead with second question. Alex is 21 months old and suffering from chronic inflammation of the trachea. So usually we will call it as inflammation of trachea means we can call it as tracheitis. Inflammation of the trachea which is causing difficulty in breathing. Physician inserted a planned incisional tracheal tube for Alex. This procedure was completed under general endotracheal anesthesia. The patient tolerated the procedure well and was returned to the recovery room in stable condition. How should physician report this procedure? We have option A 31610, option B 31601, option C 31830, option D 31615. All of you guys take 2 minutes as it is very easy question, only single code. You can write easily. So now it is 9:46. We have 2 minutes. We can start discussion of the answer at 9:49. You can take 2 minutes for the answer. If I get more answer, we can discuss the answer. Please write in the chat box in order to get confident, or you will get the confidence that I am doing good. If you are writing CPC, it is very good for you. If you are learning surgery coding, it is very good for you. So all of you write the answer in the chat box. So just write A, B or C, whatever you like or whatever you think is correct. Just try to find the keywords here. What's going actually. Thank you, Ovia. Yeah, good, good. Thank you, Sajida, Navya. Guys, all of you write the answer in the chat box. You no need to worry about whether it is right or wrong. We all are here to learning. So no need to worry about the result. So we have 1 more minute. So if you don't write the answer, it is bad for you. So we are not interested toward this session. That is your wish. Our fast coded team motto is to help the coders. So we have 1 more minute. So if you want more time, just mention in the comment section so that we can wait for few more minutes. Then only we can start the answer discussion. Yeah, we have few seconds left to write the answer. No one will provide like these free sessions. Try to utilize these sessions by providing answers properly. If you write wrong also no problem. Guys, we will start the answer. So here our keywords we need to check first. First one is planned incisional tracheal tube. So usually we will call it as this procedure is planned, and incisional trachea tube means usually we will call it as tracheostomy. So physician has used here general endotracheal anesthesia. So we will check first one 31610. Yeah. So 31610, what is this? Yeah, tracheostomy penetration procedure with skin flaps. So this is wrong. So in our question there are no skin flaps or what is the other thing? Fenestration. So directly we can eliminate 31610. So next one 31830. What is 31830? So this is revision of tracheostomy scar. So in our question there is no mention of revision. This is the initial insertion. Revision means after the initial insertion, physician will adjust the tracheostomy. As per our question, it is a initial planned insertion of tracheal tube. So directly we can eliminate 31830 also. So next we have option 31615. We will check 31615. So if we see 31615, tracheobronchoscopy through established tracheostomy incision. So usually in these procedures we have established using the established ostomy also physician will perform this insertion of the tubes. If you see this one tracheobronchoscopy through established tracheostomy incision. So established means already physician has performed tracheostomy. So but based on our question this is initial planned tracheostomy. Now we will check 31601. So if we check 31601 tracheostomy planned. So 31600 is tracheostomy planned. 31601 is younger than 2 years. So in this question, what are the keywords we need to understand? Whether it is planned or revision or what is the age of the patient. So here you can take it as tracheostomy planned for all the patients, 31601 for younger than 2 years. So based on our question, our patient is 21 months only. So we can select 31601 is the answer. I hope everyone got this answer. So you need to check whether tracheostomy is planned or revision. Yeah, you can code 31600 if the patient is 2 years. Why means clearly 31601 is stating younger than 2 years. If it is 2 years, you can code 31600. And here also you can check. This is a planned procedure, 31603 emergency procedure. So this is one type of cricothyroid membrane using the cricothyroid membrane. Thank you, Bobia. No worries. So we will go ahead with, if you have any doubts, we will discuss at the last also. Yeah. So we will go ahead with third question. Dr. Ralph, a thoracic surgeon, was asked to consult with Gabriella, a 66-year-old female with atherosclerotic heart disease. The patient who requested the visit is well known to Dr. Ralph, who performed thoracic surgery on her 3 years ago. She was seen in his office Monday morning for a consultative visit with mild complaints of fatigue and shortness of breath. During this consultation, cardiologist Dr. Shin regarding the need for another surgery to take place the following day. Monday evening, Gabriella was admitted to the hospital to start the prep for the planned bypass surgery Tuesday morning. So in this, in order to code these things properly, you need to read this paragraph clearly. You need to understand this. Why means CPT codes based on descriptions only. So here you need to find what is the procedure physician going to do and whether patient has any previous procedure performed or not. So here our preoperative diagnosis is atherosclerotic heart disease, and post-op diagnosis is also same, anesthesia general. So procedure usually in any operative report, our these initial 2 to 3 lines are just general purpose. So anyway, we'll read for now. The patient was brought to the operating room and placed in the supine position. So these positions also you need to check while reading the operative reports. Why? As you know, we have procedures using the supine position as well as the prone position. So with the patient under intubation anesthesia, this is very important. This is very important keyword. Position is very important. We'll mark here. So with the patient under intubation anesthesia, the anterior chest, see here, anterior chest means as patient is on supine position, physician is creating incision on the anterior chest, abdomen and legs were draped in the usual fashion. Review of postoperative angiography showed severe recurrent two-vessel disease with normal ventricular function. A segment of the femoral-popliteal vein was harvested using endoscopic vein harvesting technique and prepared for grafting. The patient was heparinized and placed in cardiopulmonary bypass. The patient was cooled as necessary for the remainder of the procedure and an aortic cross clamp was placed. The harvested vein was anastomosed to the aorta and brought down to the circumflex and anastomosed into the place. An artery was anastomosed to the left subclavian artery and brought down to the left anterior descending and anastomosed into place. The aortic cross clamp was removed after 55 minutes with spontaneous cardioversion to a normal sinus rhythm. These are normal ones. The patient was weaned and weaned from the bypass without difficulties after 104 minutes. The patient achieved homeostasis. The chest was drained and closed in layers, usual fashion. The legs were closed in usual fashion. Sterile dressings were applied, and the patient intensive care recovery in satisfactory condition. So now we have the options here. So check what are the keywords here. So we have 9:57 here time. We will start discussing the answer it as it is very complex. I will give you 5 minutes to answer this question. So if you want, I can down this so that you don't need to that one. So just try for this answer. This is bit complex only, but you can try. Not a problem. So there is no restriction to trying. So just to check the questions in sorry like options in the CPT book. That's enough. Sajida, Sang, Srinath, Akhil, Supriya, Ovia, Navya, Ramakrishna. Try this answer and write your answer in the chat box. So if you, I hope everyone can see the description easily. Yeah, we have got first answer. So I can do one thing. Just so now you can write easily. So if both are in the same page. So now you have the procedure and codes in the same page. Now you can try. You have 2 more minutes. Bit complex only, but we can try. So if you don't know the answer, don't worry. But in CPC exam, you need to select any one answer. Here, if you don't write also, no problem. But if you are creating a habit of writing answer here, you can write in the CPC exam easily, so that you can remember that during this session, you got to know that you no need to skip any question in CPC exam. There are no negative marking in CPC exam, so you need to attempt it. So we have 1 more minute. I got only one answer. So please write your answers in the CPT books. So if you want, just watch this session afterwards. If you want to try later this one, we can skip this question now. After completion of this session, you can watch the video again and try to answer this question. So after finding the answer, send it to vincentmedicalcoder@gmail.com. Otherwise, we can discuss in the next session. A good Ramakrishna, good attempt. Srinath also good attempt. So we will discuss this one. So basically what happened here, we need to know. So here physician has used vein grafting. These are the keyword here. Vein grafting as well as artery grafting also. Okay. So here in order to bypass, physician used vein as well as the artery. So based on CPT guidelines, if the physician performs bypass using artery and vein, we need to use only combination code. If physician performed bypass using vein and artery, we need to use combination code along with arterial grafting code. So we can't use the vein bypass code. Because of that reason, we need to select the combination code here first. So we will check 33511 first. So here two coronary venous graft. So directly this answer is correct. Wrong. Why means here physician has used one vein as well as the artery. But here A is telling us physician has used two coronary venous graft. So 33511 aka A is wrong. So directly we can eliminate this answer. So next we can see 33533. Just you need to know the comparison. If you know the comparison easily, you can write the CPC exam easily. So what is, we are nearby 33533, very near. One second. Yeah, here we have 33533. What is this? Coronary artery bypass using arterial graft, single arterial graft. So based on our question, physician has used artery graft also. So that 33533 is correct. So we will check 33517 or 2. So what is 33517? Coronary artery bypass using venous graft and arterial graft, single vein graft. So as we have discussed initially, if the physician performs bypass using a artery and vein, we need to use combination code along with arterial bypass. So here 33517 is also correct. Next 35600. We will check here. So what is this? Bypass graft procedure other than vein. This is also wrong. So directly we can remove 33511. Next one 33533, 33517, 35572, 33530, 33508. Next one 33533, 33510, 33572, 33530. So we will check D. So these all are wrong. A, B, C all are wrong. So based on guidelines, guys, can you hear me or can you watch me? Okay, Dakshayani. So our question is physician has used two grafts, vein graft as well as the artery graft. 33533 is for artery graft. 33517 is for combination of artery and vein. As per guidelines, we need to use combination code along with artery, and we will check 35572. 355. So what is this? 35572. We'll check in the book. See here, if you see in the guideline, we have to report harvesting of a femoropopliteal vein segment. Report 35572 in addition to the bypass procedure. If you check here, physician has harvested femoropopliteal vein using the endoscopic vein harvesting technique. So we need to use 35572. So we need to code 35572 also along with arterial or combination code, and 33530 we need to select. What is 3350? This is reoperation coronary artery bypass procedure or valve procedure more than 1 month after original operation. So here based on this description, patient has surgery 3 years ago. So in the same place, uh, first one is thoracic surgery, and now patient is going to have another surgery, another bypass procedure. So we need to code 33530, which is reoperation coronary artery bypass procedure or valve procedure more than 1 month after original operation. List separately in addition to code for primary procedure. Based on this description, patient has 3 years before thoracic surgery. Now patient is having another surgery. So we need to code 33530 also. We can check 33508 now. So if you, in order to code properly, we need to check the indication also. Usually in live coding, we will call it as indication or history. Now we are checking 33508. What is it? What is 33508? So endoscopy, surgical including video assisted harvester for coronary artery bypass procedure. Endoscopy, surgical, including video assisted. So here, if you see, this is the keyword here, endoscopic vein harvesting. So we need to code 33508 also. So in this, it is very important, like very knowledgeable question, this one. So here we have coded for artery bypass, 33517 for combination of artery vein bypass, 3552 for combination code, 35572, yeah, which is for, what is this? So harvesting of femoropopliteal vein, here we have three keywords. Next one, 33530. So this is, what is 33530? Reoperation, as patient has operation prior. So next one is using endoscopy. Physician uses endoscopy for vein harvesting. We need to code video endoscopy code also. So here our answer is D, 33533, 33517, 35572, 33530, 33508. If you have any doubt, we can discuss in the after all questions. So next one, a patient had a temporary transvenous pacemaker system inserted with electrode placed in the right atrial and ventricular chambers. How should you report this service? A, 33211, B, 33208, C, 33213, 33208 51 modifier, D, 33211, 33208 51 modifier. So you have now, it is 10:13. So take 2 minutes, write the answer. This is very simple only. Just to try to write as soon as possible and write your answer in the chat box. So when you code bypass procedures, you need to check whether physician is performing artery bypass, vein bypass, or whether physician is performing both. So meantime, just click on like button to motivate us so that we can create more sessions like this. You can see like button in your YouTube's dashboard. Just click on that. Yeah, thank you, Drakshayani. So I hope you guys all are trying this question. It is very easy only. Just you need to check 33211 first, whether that code description is matches with our question or not. Next, check 33208. Here also just you need to compare, nothing serious or nothing complex. Just you need to find the keywords. Whenever you write you have the question, you need to find the keyword. I got few answers, so no problem. Thank you very much. All are trying the answers. So we will discuss the answer now. So don't skip any question without answer. Try to answer all the questions without leaving. So here we need to select whenever you code pacemaker system, we have temporary and permanent. Here our keyword is temporary transvenous pacemaker system, and insertion. Here physician has performed insertion with electrodes placed in the right atrial and ventricular chambers, and right ventricular and means two chambers. So temporary pacemaker inserted in the right atrial and ventricular chambers means two chambers. So we will check 33211. So meanwhile, if anyone tries the answer, write in this box. Now we are searching for 33211. So here insertion of or replacement of temporary transvenous dual chamber pacing electrodes. So we can check remaining. First we will check 33208. So 33208 is insertion of or new or replacement permanent pacemaker. But as per our question, physician has performed temporary pacemaker. So directly we can skip 33208. Next one is 33213, 33208. As physician has performed temporary pacemaker, you can skip all these three, B, C and D. So here our answer is 33211. As physician has used temporary pacemaker, we need to code temporary insertion. Insertion or replacement of temporary transvenous dual chamber pacing electrodes. So here our main keyword is temporary. So you need to understand this word temporary. So because of using our keywords, our answer is 33211. I hope everyone got this answer. Yeah, correct, Sajida. You are good. Ashan, you need to understand. Navya, D is, so basically in D we have temporary as well as the permanent pacemaker. But in our question we have temporary only, na. So we need to check 33211, which is temporary pacemaker insertion. So here we have two, but we don't have permanent pacemaker inserted in our procedure. So here our answer is 33211, as we have temporary pacemaker insertion, not permanent pacemaker insertion. If it is permanent, we can quote 33208. So anyway, along with that, physician has can't insert permanent as well as the temporary pacemaker at the same time. So we can't quote these two codes at same time. So no worries, if you don't understand, please mention in the comment section. So we can discuss after the class. So here overall our answer is 33211, which is for temporary pacemaker insertion. So next question. Heather, a 53-year-old patient, required a conversion of single chamber pacemaker system to a dual chamber pacemaker system. The previously placed electrode was removed transvenously. The skin pocket was opened and the pulse generator was removed. The skin pocket was then relocated and a dual system was placed with transvenous electrodes in the both the right atrial and ventricular chambers. The system was tested and the now new skin pocket was then closed. The patient tolerated the procedure well. How should you report these services? So this is also a bit complex only. So we guys try for 2 or 3 minutes. We can discuss later. So first one is 33208. So but this question is related to previous question. but you need to check the keywords here. 33208, 33234, 33233, 33222, 33214, B33208, 214, 223, C208, 234, 233, 222, D214, 222. Just guys, it is very easy. Just to go to the book and check 33208. Compare this code description with our procedure. So what happens here? You need to understand exactly what was the physician performed. So now it is 10:21. We will discuss answer at 10:24. Thank you, Parimala. Thanks for your attempt. Keep it up. So cardiology bit complex only, but if you do coding regularly, we can remember easily. So try to ask your friends to attend this session and learn from our channel. If you guys has any difficulty in any topic, please mention in the comment section so that we can create one session related to that topic. Thank you, Parimala and Srinath. So as we don't have enough time, directly we can go to the answer. First, we will learn the keywords, then we can directly go to the answer. Meanwhile, you can try and write your answer in the chat box. So here, our keywords are conversion. What has physician done? Single chamber pacemaker system to dual chamber. So initially, patient has single chamber pacemaker, but because of the irregularity of the heart rhythm, physician plan to insert dual chamber after removing the single chamber. So it is conversion of single chamber to dual chamber system. So what is the next one keyword? Here we need to check the skin pocket. So skin pocket was then relocated means physician has relocated it from initial position to or initial location to some other location. In a dual shift placed with electrodes in the both the right atrium ventricular chambers, and physician has, it is clear that physician has inserted electrodes in the right atrium and ventricular chambers. So the system was tested and the new skin pocket was then closed. So directly you can check the answer here as it is very complex. It will take longer timings. So here our answer is 33214. If you find the keywords, we can write this answer easily. So what is 33214? See here, upgrade of implanted pacemaker system, conversion of single chamber system to dual chamber system, includes removal of previously paced pulse generator, testing of existing lead, insertion of new lead, insertion of new pulse generator. So these all are included in it 33214. So 33214 is resembles or code description resembles our procedure performed. So here conversion of single chamber to dual chamber system. So next one we need to check 33222. So here relocation of skin pocket for pacemaker. So as per the code description, description of the procedure, here physician mentioned relocated the skin pocket. So here we need to write skin pocket relocation also, and also we need to append 51 modifier. As physician has performed two procedures at the same time at the same location, we need to use 51 modifier. As it is not a add-on code, we can add 51 modifier. So next one we can select or discuss. I hope everyone write this answer. The people who wrote DR, all are excellent. You are doing good job. Asha, people are writing the answer, Asha. Just to try to adjust your screen. Even our system is working properly, so I can't do anything from my side. But I have zoomed it now. If you can see, you can check now. Our system is okay. So here, what is our answer? 33214, 33222, 51 modifier. What are the keywords here? Conversion of single chamber pacemaker to dual chamber pacemaker and skin pocket relocation. Those are the keywords. So next, a patient required a battery charge change for a single chamber pacing cardiovascular defibrillator system. The battery was taken out in a subcutaneous fashion and a new battery was placed. The cardiovascular defibrillator was then reattached to the electrodes which were intact. The device was programmed, threshold tested, and the skin pocket was then closed. How should these services be reported? So first check all the initial codes, like first check 33244, 33262, 33262 and 33241, so that you can eliminate easily. So now it is 10:27. We can discuss answer at 10:30. So encourage your friends to subscribe to our channel. And if anyone interested for training, tomorrow onwards we are going to start IPDRG, CIC, CPC, inpatient trainings. So if anyone is interested, send your details to vincentmedicalcoder@gmail.com. Our team will call you and discuss or clarify your doubts. So try to attempt all questions. Welcome, Asha. First check initial codes so that you can guide easily. Check 33244, check 33262, 33262, 33241, so that you can eliminate the answers or options easily. So you have one more minute. Thank you, Uvia, for your participation in this session. Where are you from, Uvia? Are you from India or US or Dubai or UAE? As our channel has subscribers from, and few people are taking training from USA also. We are providing trainings to USA also. Great, Uvia. Philippines, great. Yeah, we have subscribers from Philippines also, but mostly from like India, then USA, sorry, UAE, next Dubai, next USA, then Philippines. So now it is 10:30, time's up. Uh, we will check only initial codes, we will check and we will compare. with our code description. So what is 33244? So removal of single or dual chamber implantable defibrillator electrode by thoracotomy, 244 by transvenous extraction. So using the vein procedure, physician has removed the battery. So here it is not mentioned transvenous. So here physician has taken out using the subcutaneous fashion, not using the transvenous extraction. Transvenous means through the artery or vein, physician will remove the battery. But based on our question, physician has removed battery using the subcutaneous fashion, not transvenous extraction. So first option is wrong. So directly we can eliminate this answer. So next one is 33262. We can check 33262. What is 33262? So 33262 is, what is this? Yeah. Removal of implantable defibrillator pulse generator with replacement of implantable defibrillator pulse generator single lead system. So this is also wrong. So here battery means pulse generator. So these both are synonymous. If you see battery means, you need to understand that it is a pulse generator. So based on our question, physician has changed the battery of the cardioverter defibrillator. But 33262 is for pacemaker system. So directly we can defibrillator pulse generator with implantable deep pulse generator or single lead system. Next, this is bit correct. We will check 33241. Removal of implantable defibrillator pulse generator only. So whenever we replace, we no need to code removal code. So here 33241 is wrong. So directly we can eliminate this answer, this question answer, this option also. Next one, as we have, D is also wrong. Why means 33241, whenever there is a replacement, we no need to code removal code. So but D also includes removal code. So directly we can eliminate D also. Here our answer is 33262 and 93641. 93641 is for threshold testing. 33260 is for change of battery. I hope you guys understand this one. If you don't get, just write it in the chat box. So Asha, you need to understand what physician is exactly performed. So in cardiovascular, we have more keywords. So we need to understand keywords first. So next one, Dr. Liam completed an external ECG with 48-hour continuous rhythm testing, during which analysis was performed for Mr. Bright. The report was reviewed and interpretation completed for evaluation of change to the pacemaker system. To report conclusion stated predominant rhythm of atrial fibrillation with non-controlled left ventricular rate. Dr. Liam scheduled Mr. Bright for placement of biventricular pacemaker, which will be connected to his current pacemaker system. How should Dr. Liam report her services for the cardiovascular monitoring? Sorry guys. First check 33224, 33244, 93224, 33208 so that you can eliminate the options easily. Check initial questions, initial options first. Now it is 10:35, 10:36. I will give 2 minutes. So we will start answer discussion as 10:39. So I am giving 3 minutes. First check 33224, 33244, 93224, 33208 and compare with our question. Here we need to code for cardiovascular monitoring. You, you need to write answer properly. You need to check the or understand the question properly. So here we need to code for cardiovascular monitoring only based on the question. You have 1 more minute. Write any answer. No need to worry about right or wrong. Just check initial codes and compare with our code description. And you need to understand what you need to check first. So Via, you are doing good. Keep it up. Thank you, Srinath. Good attempt. Via, we are having these sessions every week. Please try to attend every week. So encourage your friends to subscribe to our channel in order to get latest updates. So now it is 10:38. We can discuss the answer. We can check 33224 first. Here we need to write based on our question. We need to report only for cardiovascular monitoring. These all are surgical procedures. We need to code only for cardiovascular monitoring. So here our answer is 93224. No need to write or no need to code any interpretation, all those things, pacemaker, all those things. So here our answer is 93224 as we need to code for cardiovascular monitoring. So yeah, that's good. The people who wrote answer C are all are correct. So we need to understand the question, what exactly we need to do so that we can write the answer properly. So next question. We have, I think, 3 more questions. So we'll finish it fast. So next question. A patient had a coronary endarterectomy during the same surgical session for a repair to a coronary arteriovenous chamber fistula. The fistula repair did not require a cardiopulmonary bypass to complete the procedure. How should these services be reported? A 33572, 33501, 33500, 33572, C 33501, D 33507 and 33501. Just check initial codes 33 like means 33572, 33500, 33501, 33507. Using initial codes, you can eliminate most of the options. Asha and Drakshayani, try for this question. So just check 33572, 33500, 33501, 33507. So here physician has performed 2 procedures. coronary endarterectomy and fistula repair. So here 10:40 now, we will discuss the answer at 10:42. So whenever we code, we need to check the code section guidelines so that we can do it properly. So we have 1 more minute. All of you please write the answer in the chat box so that you will get motivated. Thank you, Srinath. Yeah, time is over. We will discuss this answer. So we will check 33572 first. So coronary endarterectomy open any method of left anterior descending circumflex or right coronary artery performed in conjunction with coronary artery bypass graft procedure each vessel. So this is not correct. I will tell you why. So if you check the chapter guidelines, if physician has performed fistula repair and endarterectomy, we need to code only endarterectomy. Sorry, fistula repair, no need to write endarterectomy code. So I will show you. We have one guideline mentioned here, so I am searching that one. See here, if you see this coronary artery anomalies section, basic procedures include endarterectomy or angioplasty. So here, physician has performed two repairs, coronary endarterectomy and fistula repair. So here, fistula repair is the basic repair. So we no need to code endarterectomy with fistula repair using the CPT guideline. If you see here, you can understand basic procedures include endarterectomy or angioplasty. So here we no need to code endarterectomy code. So here our answer is 33501. So the people who wrote 33501 all are correct. I think Asha wrote correctly option C. So as per the CPT code, CPT book description or guideline, along with repair of fistula, we no need to code endarterectomy. So here our answer is 33501. If you have any doubt, mention in the chat box. So we have two more questions. We'll start next one. A patient suffering from chronic inflammation of the maxillary sinus underwent a surgical endoscopic transnasal balloon dilation procedure to restore normal sinus function. During this procedure, maxillary antrostomy with removal of tissue was completed. How should you report these procedures? First one, 31267, B 31267, 31295, C 31295, 31256, 31267, D 31297. Guys, first check the initial codes like 31267, 31267, 31295, 31297. So using the initial codes, we can eliminate most of the options. So now it is 10:46. I will give you 2 minutes. At 10:59, we will discuss the answer. Please, all of you, try to write any one answer. You no need to worry about whether it is wrong or right. Just you need to worry about how can I understand and how to learn. Subcutaneous fashion means just to physician using the scalpel or knife, he can make the incision and remove. So transvenous extraction means he will remove the pacemaker battery using the artery or vein. So if anyone wants to join in CPT training or IPDRG or ED, E&M, you can join from tomorrow. It is very nominal fee only. Yes, you can send your details to Vincent Medical Coder. @gmail.com. So our team will send the class link. You can attend 3 classes freely. So afterwards, if you are interested, you can continue. Otherwise, you can stop your trainings. So guys, so I will wait for 1 more minute. So all of you try to click on like button so that I will get motivation to continue these sessions every week. Click on like button and subscribe and encourage your friends to subscribe to our channel. And we have jobs groups also. If you are looking for any job, join in our past quarter 21 jobs groups. Currently we have 1500 members in our WhatsApp groups and approximately 1000 members in our Telegram group. If you are interested, send your mobile number to vincentmedicalcoder@gmail.com. We can add in our groups. Guys, we will check this answer. So what are the keywords here? Chronic inflammation of the maxillary sinus. So in medical words, we can call it as maxillary sinusitis. Itis means inflammation, and here inflammation of the maxillary sinus. So we can call it as maxillary sinusitis. Underwent a surgical endoscopic transnasal balloon dilation procedure to restore normal sinus function. During this procedure, maxillary antrostomy with removal of tissue was completed. How should you report this procedure? So here our main procedures are balloon dilatation or dilation and maxillary antrostomy. So here we will check the answer. We will check 31267 first. What is this? Nasal sinus endoscopy surgical with maxillary antrostomy. So we have along with maxillary antrostomy, physician has removed tissue also. So 31267 is correct. But based on the CPT book instruction, we can't quote 31295 along with 31267. So directly we will eliminate answer B, as we can't quote 31295 along with 31267. 31295 is the dilation of the nose. So we can't quote dilation along with the antrostomy as per the CPT guideline. If you see here, do not report 31267 in conjunction with 31233, 31237, 31256, 31295 when performed on the ipsilateral side. So what is ipsilateral side means? Write your answer in the chat box. What is ipsilateral? Write fast, guys. So I think most of the people don't know about ipsilateral or contralateral. So if the physician has performed correct Srinath, basically we have two lateralities in CPT coding, like ipsilateral and contralateral. Ipsilateral means same side. Contralateral means opposite side. So here, based on this guideline, if the physician has performed 3-1 like removal of tissue from maxillary sinus as well as the dilation of the nerves on ipsilateral side means same side, we can't code 31295. So using this guideline, we can't code dilation along with maxillary antrostomy with CPT tissue removal. So directly we can eliminate this answer B 31365, 31295. So this also we can eliminate 31295 and 31267. Here 31297. We can check what is 31297. So 31297 is related to sphenoid sinus ostium, but our question contains maxillary sinus. So 31297 is also wrong. So here our answer is 31267. Why 31267? Whenever the physician performs maxillary antrostomy with tissue removal, we can't code balloon dilation code. So transnasal balloon dilation code we can't code using the CPT guideline. So here our answer is 31267. So guys, whenever you check any code in the CPT book, check above and after nearly 3 to 4 codes. Like if it is 31267, you can check 31266, 265, 264, and after 268, 269, 270. If you check like that, we can code properly. And we need to check CPT guidelines also using the brackets here. If you check here directly physician like CPT has provided these guidelines. We need to check after the code descriptions. I hope everyone got this answer. So we are going to attempt last question today. Afterwards, if you have any doubts, we can discuss. So a patient underwent a recurrent destruction of the laryngeal nerve for therapeutic purposes. How would you report this procedure? 31595, 31599, 31595, 64681, 59 modifier, 64614 and 31599 and 59 modifier. Now it is 10:54. I will give you 2 minutes. Like 10:57, we can discuss the answer. So if anyone interested for trainings or if anyone interested to join in our WhatsApp groups as well as the Telegram groups, please send your details to Vincent Medical Coder at the rate of gmail.com so that we can add in our groups. Just follow our LinkedIn group also. We have accounts in LinkedIn, Instagram. Just write passcoder 21 you can find our groups. Yeah, that is not correct to Drakshayani. Only 31267 is correct. Yeah, 31267, 31295 are not correct. You are correct. So try this answer. Afterwards, we can discuss elaborately. So we have 1 more minute. Thank you, Parmala, for your attempt. So we are providing training to US people also. So if any one of your friends are present in US, tell them that we will provide trainings also. Currently, we are providing trainings for US coders. So we will discuss the answer now. So a patient underwent a recurrent destruction of the laryngeal nerve for therapeutic purposes. How would you report these procedures? So we will check 31595. So we don't have 31595 in the code book. So we can directly eliminate 31595 A and C, as there is no code in the CPT book. Next one is 64614. So we don't have 64614 also. Directly eliminate C also. D. So here directly we can eliminate A, C and D. So here our answer is B, 31599, as there is no code for destruction of laryngeal nerve. 31599. So which is unlisted code. This is for vocal cord we need to use unlisted code, but larynx also we need to use unlisted code, as we don't have any separate code for this procedure. So here it is unlisted code. So you need to check in that way also. In exam you may find deleted codes also. So try to have a vigil on that aspect also. So I hope you guys understand this session and you have used purposefully. So if you have any doubts, we will stay here for 5 to 10 minutes. If you have any general topics or any types of doubts, please mention in the comment section, we will discuss. So nothing is complex, just to compare, we need to know how to compare code description with our question. So if anyone has now it is 11 o'clock. We will stay up to 11:05 or 11:10. If you have any doubt, please mention in the chat box so that we can discuss. Thank you guys. Thanks for your appreciation by clicking on the likes. Fast Coder 21 motto is to help the coders and educate the coders. So if you have any type of complex section, if you find in while coding, just to keep it in the comment section, or directly you can write to vincentmedicalcoder@gmail.com, so we can try to help you. So if anyone wants to or like to join in our WhatsApp groups, just send your name or your certification if you have any, and if you're interested training to fastcoder 20, sorry, vincentmedicalcoder@gmail.com, our team will call you. So guys, so do you have any doubts now? Whether it is subject related or general purpose or channel related, or how can we develop our channel more than this? So who are attended today? Supriya, Santosh, Navya, Akhil, Sindhu, Anil, who are else? Ramakrishna, Devanshi. So if you have any doubts, so mention in the comment section, we will discuss. Otherwise, we will end this stream or this session. Akhil, Srinath, Ovia. Thank you, Ovia. Thanks for attending this session. Kindly encourage your friends to subscribe to our channel and attend these free sessions. Yeah, just we need to find the keywords. Thank you, Sajida. Asha, Drakshayani, Parimala. So, okay. Thank you, Srinath. Thank you very much. And also encourage your friends to subscribe to our channel and gain benefit from our channel. So, why means we are providing all specialty coding related topics. So, if you have or if your friends find anything difficult, just mention in the comment section so that we can create one session related to those things. So it is very useful, sir, for everyone. Thank you, Srinath. So I want to write CPC exam next month. Yes, yes, Srinath, you can write the CPC exam. Tomorrow onwards, we are going to start one new session. So I will be available at all time. So if you want, you can join tomorrow. Our team will send class link. You can attend 3 days freely. After 3 days, if you are interested, you can continue. Otherwise, you can stop your. If you want, just to send your details to vincentmedicalcoder@gmail.com. Yes. So who else? Anyone has any doubts? Parimala and Yasin, did you get the answer? Subcutaneous fashion means sub means under. Cutaneous means skin. So under the skin. So whenever we have a term, we need to divide it and understand. Sub means below. Cutaneous means skin. So subcutaneous means below the skin. So here physician make incision below the skin and he can remove the pacemaker in our question. No, Parimala, we have only Sunday live. And basically, every week we are providing 3 sessions, 2 YouTube sessions, and 1 live session. So only 1 live. So monthly you can find 4 to 5 live. So and also all of you watch other sessions which are related to anatomy 1 session and integumentary 1 session already in our channel. And most important musculoskeletal last week we have completed. Watch that also. Those are good. Using these sessions, we are going to learn all the basic things. If you are writing the CPC exam, also useful. Or if you are trying to enter into surgery coding, also these basic things are very useful. So now it is 11:06. I will stay until 11:10. So if you have any doubts, please mention in the comment section. Rakshayani, do you have any doubt? Obia, Asha, and who else? Ramakrishna, Yasin. Yasin, you got answer, na? So subcutaneous fashion means under the skin. So basically it is physician will make incision below the skin. So if anyone interested, just send your mobile number to vincentmedicalcoder@gmail.com. So we can add you in our WhatsApp groups as well as Telegram groups. So we have different groups for jobs as well as the free training videos. Usually last week, like 2 weeks back, we have conducted one poll in the WhatsApp groups. So everyone interested at 9 to 10 in the evening. So we have started this at 9:15. We will try to maintain the same time. Next week also 9:15 IST, 9:15 p.m. IST. Rakshan, you got na? So every week, if we have any live class, we will mention in the our WhatsApp groups, LinkedIn, Facebook, as well as Instagram. You can join. So if you want to join in our WhatsApp groups or Telegram groups, just send your mobile number to vincentmedicalcoder@gmail.com. I will add you in the groups so that you can get latest updates. Guys, we have only 1 minute. So if you have any doubts, please mention in the comment section now. Otherwise, don't worry, just you can comment in the videos also. Otherwise, you send your doubts to vincentmedicalcoder@gmail.com. I hope this session is very useful for you and encourage your friends to subscribe to our channel. And if any of your friends wants training, please let them know that Fastcoder 21 is providing CPC, CIC, ED, E&M surgery trainings also. So we have only 1 minute now. So if you have any doubts, please mention in the comment section. Thank you guys. Time's up now. Don't worry if you have any doubts or any complexity. Not my phone number, Srinath. Just send your phone number to vincentmedicalcoder@gmail.com. I will add you in the our WhatsApp groups and Telegram groups. Send your number to vincentmedicalcoder@gmail.com. Drakshayani, no need to worry. After this session, you can watch this session again. So this video will be in the Fastcoder 21 YouTube channel. You no need to worry. Afterwards also you can watch. So you no need to worry. You can watch after ending this stream also. So this video is available from tomorrow. So if you have any doubts, please send it to Vincent Medical Coder. We will try to rectify. Thank you guys. Thanks for watching Fastcoder 21 and thanks for attending this session and using your valuable time. So if you have any doubts, send to vincentmedicalcoder@gmail.com. We are providing trainings also. So if your friends are interested for trainings, send your details to vincentmedicalcoder@gmail.com. Thank you guys. Thank you very much. All of you, good night. We will meet you on next week.